From United Nations Television, this is UN in Action.
The Congo River, one of the world's mightiest waterways, has for centuries carried people and goods through some of Africa's most inaccessible rainforests. It also carries disease. Last year, a cholera outbreak in the Northern Democratic Republic of Congo spread down and across the river into the neighboring country. Particularly hard hit was Isle Mbamo, a large island about an hour from its capital, Brazzaville. It has 13 villages. When cholera hit, people here had no idea what it was or where it came from. Dimitri Fabrice Okulakami, a local fisherman, lost his nephew to the disease.
For my nephew, when he started having diarrhea, he became like a skeleton. Within a half a day, he died.
Dimitri mourns his nephew and understands his parents' pain. He, too, almost lost his own son, Stuart, to cholera.
It started at 3 a.m. By 8 a.m., he had lost weight and became like a skeleton. I thought, no, I must go to Brazzaville.
Stuart was lucky. After 6 days in hospital, he recovered fully. The island has no running water and very few latrines. It's the perfect place for cholera to thrive. When the outbreak hit Brazzaville, squatter settlements like Sieme Bridge with poor sanitation were the worst hit. Latrines here feed directly into the same stream in which children play and people bathe. John Didiu Konongo, cholera specialist, World Health Organization.
Cholera is a disease linked to poor hygiene, a disease caused by poor sanitation, a disease caused by lack of access to water. It is called the dirty hands disease.
In response to the outbreak, UNICEF and the World Health Organization, with financing from the United Nations Central Emergency Response Fund, have launched initiatives to combat cholera. Marianne Flatch, UNICEF representative for the Republic of Congo.
The Central Emergency Response Fund has been very vital in bringing quickly assistance to the areas that were affected by cholera. It's a population that needs a lot of our assistance, and we often forget about them.
On Isle Mbamo, there are now chlorination points where workers have been trained to purify water from the Congo River that households use. Latrines have been built in public spaces like markets and schools. A social mobilization program is now teaching villagers the importance of hygiene. Children are learning about washing their hands with soap and using the new latrines. As the next rainy season is fast approaching, the potential for new outbreaks of waterborne diseases like cholera continues to be a threat. With better sanitation and clean water, communities along the Congo River will now stand a better chance of protecting themselves and their families. This report was produced by Guy Hubbard for the United Nations.